So, hello everyone. Welcome back to our sort of study of Materia Medica, and let's study our remedy for today. And the remedy that we are studying today is opium. Okay, so opium. So what I will do is I will narrate to you various cases that I have seen of this remedy and how you can develop the picture of opium from that. Okay. So the first case is of a child who came to me for recurrent fevers. Okay. The child was having fever every 15 days. And in spite of heavy antibiotics for a very long time, he was not recovering. He used to take 10 days to recover, and by the time he recovered, another fever would develop. But this time, strangely, even after giving antibiotics, even after 10 days, his fever was not reducing. That is when he comes for homeopathy. And they say that he has very high grade fever, and it is around 101 degree Fahrenheit. And he's not able to sleep properly, and he has nose block. mm, and So I asked them that how is the fever, how does it start, why does it start, etc. So they say that we have not been able to identify any cause for the fever, whether it is because of weather, food, or anything. We are not able to identify. But one thing is sure, that he always develops his fever at night, at at night during sleep. So suddenly at night he will wake up, he will jerk, he will jerk, and he will sort of startle, and then he has sort of, this jerking kind of thing, and he will wake up, and then we see that he has woken up with a jerk and he's crying. So we go to see him, and then we see that he has developed fever of 101 degree Fahrenheit. So I asked them why, what happens at night, why he develops. They say, we don't know what happens. I said, what time? They said, it varies. Sometimes it's early morning, sometimes it's 2 a.m., sometimes it's 4 a.m., sometimes it's 5 a.m. And it's mainly after he develops from this jerk. So I asked them, how is the sleep? They said the sleep is a problem. Every time he's sleeping, his eyes are always half open, never fully closed. While sleeping, his eyes are always half open, or they are half closed. And whenever he develops this fever, he's always sleepy. Matlab, during day or night, he's always sleeping a lot. Okay. So based on this, I think he had one more symptom, which was hmm, he had this lacrimation cough during. Based on this, he was given the remedy opium. You see, sleeps, jerk starts during, and eyes half open, sleep in. Hmm? So I gave him opium, and after which it's almost 6 months now. He's not having any episodes of fever. I think after 6 months he had one episode of fever. I just repeated another dose, and then since then he's again doing much better. Okay. So what do we learn from this? What is most important in this case? Where are all the symptoms found? They are found in the sleep. Correct? So sleep is a very important symptom of opium. Firstly, there will be drowsiness, excessive sleepiness. It is one of the trio of sleepiness. Patients sleep and sleep and sleep and sleep during the complaints. It's a very drowsy, sleepy remedy. Top 3 remedies in our Materia Medica, if you have to say for sleepiness, are Nux moscata, antimony tart, and opium. These are the top 3 remedies for sleepiness, drowsiness, all these complaints. Okay. Sleep is very important in opium. Sleepiness. So one is they are very sleepy, and the second is, as you already observed, they can sleep with half open eyes. Sleeps with half open eyes. What is more important is they seem to be, the eyes seem to be non-reactive to light. So one of the important symptoms of opium is pinpoint pupils. So even if you put a light, generally you will see if you put the light, the pupils will contract. If you remove, the pupils will expand. You can see this with the torch, you can examine. But in opium, they just don't seem to react. Even if you put light in their eyes, they'll just look. You see, what is this? This child is not reacting. Non-reacting. They just don't react to light. Okay, so that's why it is a very important remedy for coma. When there is complete loss of consciousness. Even when you pinch the patient, even when you try to wake up the patient from this deep sleep, even when you try to hit them, do anything, they just don't seem to react. They are non-reactive. They are in that deep sleep with no reaction to anything. There is no bowel movement. There is no urination. Everything seems to have gone to sleep. So the bowels are paralyzed. The bladder is paralyzed. So one very important symptom in opium is that they have anuria. Anuria means there is no urine. They just don't pass any kind of urine. If you examine and if you hit their abdomen, you examine, you will feel that the bladder is full. There is a lot of urine in the bladder. There is actually distension of abdomen. They will say the bladder may burst. It has lots of urine, but he's not passing even a single drop of urine because the bladder is paralyzed. It has got contracted and it's not passing any amount of urine. The moment you give opium, immediately it starts passing urine.
Is there the desire to pass urine?
No desire. There's no reaction. That is the most important vital symptom of opium. There is no reaction. There is no pain. There is no sensitivity. They just don't have the urge. They don't feel the urge. They don't feel the pain. They don't react to light. They don't react to anything. There is no reaction. Even if there is a sensory stimulation, that is what I mean. You pinch him, there's a sensory stimulation, no reaction. You hit him, no pain, no reaction. You put light, no reaction. Just no reaction to anything. This is the main idea. And different organs are only manifestations of this idea. Bladder, urine cannot pass urine. This is not the symptom. The symptom is there is no reaction. That's why he's not able to pass urine. There is no nerve stimulation. Even after taking laxatives, they are not able to pass stools because they don't react even to them. Very severe forms of constipation. Are you getting this? No reaction, no pain, no vital reaction. This is what is written in the Materia Medica if you read. This is what it means. Even after giving sensory stimulus, patient does not show any reaction. There is fullness of bladder. Bladder may burst. You can imagine how strong the urge should be when your bladder is so full. There has to be a very strong urge, but there is no urge, no desire, not even the consciousness that there is an that the bladder is full. They don't feel, sense anything. Not able to sense things. Not able to sense pain, not able to sense taste, not able to sense what they are seeing. Everything seems to go numb, senseless. That is the idea. Everything is just going to sleep. Just going to sleep. Everything. The whole nervous system, mainly the nerves and the nervous system, is going to sleep. Everything is just sleeping. Patient is in coma, you put light, no reaction. Bladder is full, you tap full bladder, no urination. Lot of stool in the large intestine, but zero urge. Getting this? That is very important. Similarly, one very important keynote symptom of opium is no pains. There is no pain. So you will see that, especially in cases of autism or mentally retarded children, hmm, or mentally retarded children, you will see that the mother will say, Doctor, now what happens? This child, I can't take him. He's not so developed. He is mentally retarded. But how I came to know that he is having autism is that one day he was playing in the bathroom, and I don't know how and what happened. The bathroom mirror got cracked. It broke to pieces. It fell on his hand. His whole hand got cut. He was bleeding, but he was just sitting there like nothing happened. And I was like, what is happening? I don't know after how long I went to see him, but I can see bleeding, pain, but no crying, nothing. He's just sitting there. He just does not seem to cry. He just does not seem to complain. He's just sitting there. There are no pains. There is neurological problems, central nervous system problems, senses. What happens in autism? Sensory functions are disturbed. No, either there is excessive sort of stimulation. Oh, this noise is too much. I cannot tolerate. Or I've lost the ability. I can't hear. I can't smell. I can't taste. There is loss of a function. Sensory function is lost. So one becomes hyper, another becomes lost. That is what happens in autism. The, they are called special children. Why? Because they develop special ability. They will lose their ability to talk, but it seems they can hear much more than what we hear. Or they develop some artistic ability. Some other sensory function becomes hyper stimulated or is excessively working for them. But mainly it is nerves. In opium, always remember central nervous system. Everything is nerve and central nervous system. Nerve and central nervous system. And what essentially happens to the central nervous system is it becomes non-reactive. It goes to sleep. Non-reactive sleep. You see, you saw the first case. There, the mother is not complaining that he's coughing a lot, that he has cold, that there is yellowish greenish expectoration. Infection will not be the main problem. Main problem will be the sensory stimulus is not there. It's difficult to wake him up. He's always sleeping even in that high-grade fever. Mother is not saying, oh, he's complaining. Oh, such high-grade fever. He cries in the fever. No. Mother is, oh, such high-grade fever. And child is always sleeping. He's become very weak. He's become very non-reactive. Nothing. He's not asking for food. He's not asking for anything. All sensory stimulus are gone. Hunger is not there. Does not ask anything. Does not seem to suffer. Even if you see so many symptoms, there is no suffering. There is no pain, no suffering. So I remember once, one of my teacher was showing a case. In that case, the child had what? And then he said, you know, that day I was walking and then someone came chasing me. So I got scared that this person will come and catch me. So I jumped out of, I climbed up the gate and I fell down from that gate. So then what happened after you fell down? Then what? I fell down and then I started running. So he said, you didn't have any injury, pain, anything? Ah, something might have got hurt, but no, nothing. That is opium. They just don't seem to have the idea of pain. You fell down, you got hurt. Where is pain? No pain. There's no idea of pain. Get this?
Wouldn't you also get the opposite then? I mean, of great pain?
Yes. Then you get the opposite. Opposite is what? Sleeplessness. First thing. We started with sleep, no? Opposite will be sleeplessness. From what? Slightest of noise. Even a noise very, very far away I can hear and it will disturb my sleep. Get this? There is hyperstimulation of the nervous system. I can hear even the slightest noise. I can smell the slightest thing. I can taste the slightest thing. I can sense the slightest amount of touch. And I will wake up from my sleep. Get this idea? So there is always the opposite, where it is excessive nervous stimulation. That's what I meant in autism, no? One will get completely dull, but other will become very hyper vigilant. So they will have excessive stimulation. Hmm?
So, like Anjum asked, does that come through with pain as well?
Huh? So you will see the opposite is painful, excessive pain, slightest injury. Oh, it's so intolerable. I cannot tolerate this pain. Oh my God, the pain is unbelievable. I can't even see this pain. I can't even sense this pain. Don't give me this pain. It's too much for me. So, one polarity, there is numbness, painlessness, everything is going into sleep. Hmm? And everything is non-reactive and painless, right? So the opposite will be hypersensitive, or sleeplessness, or excessive reaction, and intolerable pains. Okay. So hypersensitive, I told you, slightest thing they will start sensing. Slightest thing will cause them sleeplessness. Excessive reaction. Excessive reaction means what? So another very important idea of opium is they are very sensitive to pain or any kind of suffering. Okay, so they will say, I see slightest amount of pain here and there, and I cannot tolerate. It affects me profoundly. Oh, doctor, I see beggars on the street, and it affects me so much. I keep thinking about them for months and months. Oh, so much. How painful it must be to sleep in that cold with no blankets, sleeping on that floor. Oh, God, so much of suffering. Why did you create this world with so much of suffering? Why did you give them this body? They are suffering so much suffering. Oh my God, I have to go to the surgery. I saw in that surgery, they cut open their injury. I saw accident. In that accident, I saw someone's hand getting fractured and they bleed. Oh my God, it's terrible. I can't see it. Oh, don't show me. Oh no, no, I can't even think. Just the thought of that injury, just the sight of it is too much for me. Oh my God, I can't do it. So they will tell you, I can't I can't see pain, I can't see suffering. Just if someone tells me that, just the next street, there's been an accident. Oh, so much pain must be there. I can't see. Oh, I start suffering just by hearing that. I've not even seen. It's beyond my comprehension that I see it. I cannot see it. The sight of it, the smell of it, the taste of it, it's too much for me. No, 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 don't talk about it. I can't hear this. Don't show me that picture. I can't see it. Oh, it's too gruesome. Oh, it's too painful. It's too much. Don't talk. Don't, no, 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 no. I can't see. I can't hear. Get this? This is the opposite polarity. Excess. There you were hitting, slapping, nothing happened. Here, even talking is too much. Oh, don't talk. Don't show me pictures. Oh, I can't see such a movie. I can't hear war stories. I can't hear that beggar story. I can't hear about someone's accident. Excess. They feel the pain. The pain is too much for me. Don't show me. So one of the main ailments of ailments after, complaints after, fright. Main remedy is opium. You know, I saw a frightful accident. Oh my God, such big accidents can happen. And that incident has just remained in my life, in my mind. That pain that I saw, that accident, that blood, that fracture, that intestine coming out, that wound. Oh, it's too much. Since that day, I have not been able to sleep. I've lost my sleep. I've become too sensitive. I start crying just by hearing someone's emotion, hearing someone's pain, someone's suffering. And I keep asking, why is there so much pain and suffering in this world? Why do we have to suffer so much in this world? Why is there so much pain? I don't want this pain. What do I want? I want anesthesia. I want no pain. I want numbness. I want what? I want liberation from this world. I want to go beyond this world. This world is all full of pain and suffering. Whatever do you do, how much ever you do, there is always going to be suffering and pain over here. Pain is sort of inevitable. It is always going to be there. Pain is inevitable in this world. So what I want is liberation. So I want to liberate myself. So what they will get into? They will get into spirituality. Meditation. So I want peace. I want tranquility. I don't want to be disturbed by these worldly things. Too much. I've had all of this, but this is all too much. Now I want to give up this world and become a spiritual person. The pain is too much for me. The suffering is too much for me. I can't take all of this. I want to do something to relieve the suffering in this world. I want to bring the message of peace. I want to teach everyone the importance of meditation and spirituality. That is your only way out of this world. So I want to do good. Why? Just to relieve suffering of others. Nothing else. I have no interest not to earn some name or fame or all that. No. Just to see the pain relief going away, reduce pain and suffering in other people life. That itself is very satisfying for. So another very important symptom of opium is benevolence. They just want to do good for others only because it's good to do good. Only to relieve their suffering and their pain and because their whole perception of life is painless or pain and painlessness. Either there is no pain or no stimulation or no reaction, or excessive pain, excessive stimulation and excessive reaction. And the only way out is meditation. Get this? This is the main essence of opium. Fear, fearlessness, pain, painlessness, excessive stimulation, no stimulation, paralysis, numbness, paralysis or trembling, excessive movement, convulsions, Either there is paralysis or there is excessive movement, convulsions, trembling, involuntary movements, chorea, twitching. Get this? One extremity, the nerves will go completely numb and you're paralyzed. My whole right side is paralyzed. My bladder is paralyzed. My stomach is paralyzed. My tongue is paralyzed. Another is excessive movement. My hand is moving involuntary. I'm having twitching, convulsions, chorea, all that. But the main idea in opium is no reaction or excessive reaction. No pain or excessive pain. That's the main essence of opium. I'll take your questions, but later on. So I told you, in coma, what is the main symptom? You will examine what?
No reaction to an impulse.
What kind of? This is a general symptom. That's what you have to understand. No reaction is the general symptom. It will be seen in every single part. But in coma, what did I say specifically? Where you will
If you
examine?
pinch them, then they won't wake up.
But it's also common symptom of coma. All coma patients will, you pinch, they will not wake up.
They won't react at all.
To what?
Pinching or a physical impulse.
But all coma patients don't react to any kind of pinching or... you said the next thing is, specifically if you see the eyes, pupils not reactive to light. That is very characteristic. Another example was?
Half open eyes or half closed eyes.
Okay. Another organ we learned?
Bladder.
Bladder. What you'll see in the bladder?
It'll be full and distended, but if you push it or there's an impulse, then there will be no urge to urinate.
So, anuria with distended bladder. That's what is the symptom written in. There is anuria. They are not passing any urine, but the bladder is full with urine. Constipated, hard stools. So there are other remedies. So if you have, suppose we said one of the complaints of opium is ailments from fear. No, one of the other remedy that also has ailments from fear and also has suppressed urine is? Anybody?
Right?
No. Another remedy is stramonium. Okay. So, in fear, what generally happens is, physiologically speaking, when you have a fright and flight response, what will happen is the body will say that let only the vital organs function. Okay, so you will have, what are vital organs? Vital organs are heart, lungs, and brain. These are three vital organs. So what will happen? The heart will start beating faster when you get scared. Okay. What will happen to the lungs? You will start breathing faster. You will start hyperventilating. And then palpitations. Your brain will become vigilant. You'll start hearing easily the slightest thing. Everything will become vigilant, alert. You'll start hearing, smelling, tasting, everything becomes alert, active. But all other things becomes dull. So like, for example, your bowel movements become dull. Your urination becomes dull. Your mucous membranes start to dry down. That's why you feel like drinking water. You see, I got scared at that time. I want to drink water because the moment the body tells that this is a fight, stop, dry up. Every other organ is not important. Vital organ is only important. So your mucous membranes start to dry up. There is dryness in throat. There is no urination. There is no bowel movement. There is no digestion. So that is what happens in stramonium. It is fright and flight response. So you will see that the patient will say, I got scared. I thought that someone is going to come and kill me, or I'm going to die in this situation. I got scared. And then I started to hyperventilate, breathe, and all this. And then since then, I have stopped creating urine. The difference is in stramonium, the bowel function stops. The creation of stool stops. Digestive function stops. I don't feel hungry. Whatever food is there is not got digested. Whatever urine is there has stopped being formed. The whole urination is, the process of urine formation itself is stopped in stramonium. Get
How
this?
do you differentiate? I don't, how would you pick that up? I mean,
Simple. You examine the bladder. There will be no urine. In
no,
stramonium, there
that's
will
not
be.
something we can do. We are not taught to do examinations.
So then you can, it's even still it's easy. You can ask some houseman doctor, you can ask some um, doctor there, is there bladder in the urine or is there no bladder in the urine? That much everybody will tell. It's also written in the case file. Or if you don't want to ask, you can ask the patient to ask their doctors. They can
You can
ask.
tell as well, if you just push on your bladder and your bladder's full, you can feel that there's urine in
Yes.
there. And
Yes.
if there's no urine in there, you can tell the difference.
Oh.
Yeah, true. Yeah.
That's the main thing. Now, causticum also has urine problem, but it is not so much known for anuria. Causticum is known for involuntary urination. So it is said that causticum is specifically for what women who sort of, because they don't want to go to the public toilets, because they feel very awkward, they try to control even if the bladder is full. Due to whatever reason, you just strain your bladder for hours. And no, after going home only, I'll pass urine. Now, I don't like, whatever. There can be hundreds of reasons why someone is not passing urine. But because they have strained their bladder so much by not passing urine, even when they have the urge, even when they are feeling the bladder is full, they know the bladder is full, they know the urge is there, but they are not passing urine. Then someday, if this continues for many days, someday the bladder gives in. Then they feel, now I am not able to control my urine anymore. From the slightest sneeze, from the slightest cough, from the slightest move, I feel few drops of urine pass away without my knowledge. Without I knowing, I pass few drops of urine. While coughing, I'll pass urine. While sneezing, I will pass urine. This is the main characteristic symptom, confirmatory symptom actually of causticum. Involuntary urination during coughing, sneezing. Get this? That's the main difference. So, that is what is opium. I've told you. If you know this much, you know opium. So opium basically belongs to Papaver. Okay, I'm not good with spellings. Papaver family. So, Papaver family, the main theme is painlessness and painfulness. You understand why it is painless and painfulness? That I cannot tolerate all this pain and suffering. I cannot see all this pain and suffering. The opposite is I want to liberate all this pain and suffering, or I have no pain. Okay. So one case I heard of Dr. Sankaran was that one of his patients, all of you know that there was a big terror attack in Mumbai in 26 November 2008 at Taj, Hotel Taj and all that. So one of his patients was actually in the Taj Hotel at that time. And that patient, he was standing, all of them were around 50 or 100 people in one room. And the terrorist came in, he just shot all those randomly. He started shooting everyone. And this patient, he just sort of fell down and he acted as if he is dead. And somehow he got saved. And then he comes to him and he says that I was there and it was very scary and all that. So what did you feel going through all that? Well, that is the whole thing. He says, I felt nothing. I saw all that, but people keep asking me, how was your experience? What was your experience staying there and facing those terrorists, etc.? But I have no experience. I have no thoughts, no feelings, nothing. Nothing is there. That is opium. They just don't feel. It's a situation full of fear, violence, bloodshed, suffering, pain. No? But they don't feel anything. Or what will happen? They will feel that they will have sleeplessness, hyperreactivity. They will start seeing everything. They will start reacting to the smallest sensory stimulus, lose their sleep. Or they will still be able to sleep, or not just able to sleep. They will sleep even more. Sleep is disturbed means what? Not normal sleep, excessive sleep. That's what trio of sleep, excessive sleep, very deep sleep. In spite of trying to wake him up, he will not wake up. That is opium. I am done. If you have any questions, please go ahead.
I've got a couple of questions. So in terms of so that kind of lack of reaction, will their face kind of, you know how some people look like they're on drugs? They kind of like all kind of daisy and like, you know, sort of, or is that likely, are you likely to see that as well alongside this? You know what I mean?
They may look a little bit, but the main thing is you should feel that in spite of sensory stimulus, they are sort of not reacting.
Okay.
The main thing is this sensory reaction. What is the sensory reaction? To pain, to touch, to smell, to odor. What is the sensory reaction?
And that sounds like it's emotional as well from that terrorist attack case.
Yes, it's also emotional.
And then my other question was, do they have, so you said that they want to leave this world and anesthetize themselves. So they might do that through spirituality. are they also, is there an addictive side? So will they take drugs?
It's
Will
a
they...
drug remedy. So opium is a drug.
Of course,
So
yeah.
they take the drug so that they don't feel the suffering. Why do people become drug addicts? They feel, oh, this world is too much. I will take this drug. I will not feel all this pain and suffering. It is a drug. All of us knew, no?
Yeah. But that doesn't mean that, in my world, that didn't mean that they want to take drugs. I just wanted to check. Yeah, thank you.
Yeah, they may.
Thank you. That's my questions.
Anyone else?
From your description, it sounds, Shrikant, as if we should give this to all of the Zen monasteries.
Why?
Or, well, you said that this is, people who are trying to escape to spirituality, to tell everybody about meditation and stuff like this. So we should wake up the monks, shall we?
No, but the monk's feeling should be that I came here because I cannot take pain and suffering. The
a lot of
central
people
theme has to be pain and suffering.
A lot of people end up in monasteries because of that. So potentially, but anyway, that's not my question. My question is this: how do you differentiate opium? Because in a state of depletion of cellular energy, so things like chronic fatigue syndrome or MS sometimes, or fibromyalgia, you will have states of a complete kind of depletion of energy. If there is a low metabolic state in general, it's very difficult to elicit any reaction to any of the stimuli, because there simply isn't enough energy in the system to produce a reaction. It's a little bit like this idea of giving sulfur to wake vital force up a little bit, that Hahnemann used to do at the beginning of each treatment. So anyway, how do you how are you able to say that this isn't an opium state in dose diagnosis?
Because the answer lies in your question, that the main thing patient will talk about is weakness and exhaustion. In opium, I did not mention once about weakness and exhaustion.
Okay, yeah. So what are they going to talk about physically?
Who?
Opium people. What are they going to talk about?
They will say, but I have this pathology, I have this paralysis, but I have no symptoms. I have no problem. And
There
then
will be tiredness, presumably. There's fatigue, but not weakness, yeah? It's a drowsiness, so there must be fatigue.
So there is drowsiness. That does not mean fatigue.
Okay.
I just feel like sleeping. What's the problem with sleeping, they'll say. I just feel like sleeping. There's no weakness, there's no tiredness. I just like to sleep. I just I just like to go numb. Senseless. Just go to sleep. That's it. I like sleeping. I just sleep and sleep and sleep and sleep.
Sounds like any teenager. Yeah.
Exactly. But then you have the excessive sleepiness. You must do, because otherwise, so you have the excessive sleepiness, and they'll say, I'm just so tired all the time. They will say that because there is no differentiation between the sleepiness and tiredness. There may not be differentiation enough understanding between the difference between the two, right?
So, firstly, Anna, if the patient start talking about weakness, you'll not think so much about opium. And also, what is very important is, I think your question is that, does this mean for chronic fatigue syndrome, you will not give opium? Because all chronic fatigue syndrome patients are going to talk about weakness. However, they all have nerve symptoms. No? So what I am trying to say is that presenting symptoms Okay. Can be fever, like we saw in the first case. No, but I did not talk anything about fever in opium. Right? When you start seeing that the whole problem in the fever is during sleep, then you know it has to be a remedy which has to do with sleep. And whatever symptoms come during the sleep become important. Similarly, when you have a nerve case, suppose a chronic fatigue syndrome, and you are taking history, and in the history you feel that the main thing is that after a particular fright or after a particular incident, he has become like this. The first symptom was numbness, paralysis, senseless. And then the pathology took its course, that after that, slowly he started becoming weak, drained out, etc., etc. That is why I keep saying in case history, it is very important to elicit the cause and the first symptom. Otherwise, you get lost in the story. It's very difficult otherwise to differentiate between what is pathological symptom and what is the actual keynote symptom. Does this clarify, Anna?
Sort of, yeah. I guess I'll have to elicit in practice. Yeah.
So the first symptom is where you will get. What is the reaction? First reaction to the excessive, to the stress or stimulation, or what happened? In a particular situation, incidents, causative factor, what happens to him? What does he see? What affected him? And how did it affect him or her? In first situation, second situation, what were the first main things? Then comes pathology. Pathology always comes later. First, you will see functional disturbance. In the functional disturbance, you will know the remedy. If you're trying to take all the symptoms of the patient and then say, oh, now tell me which remedy, then it's all mixed up. Then it's all confusion. That's why I'm saying not all symptoms of the patient have to fit. But the main keynote symptom have to fit. That you have to define in every case. What is the main affinity? What is the main thing that has happened? Not simply diagnosis. Your question is with regards to diagnosis. But we don't treat the diagnosis. We treat the person behind.
I get it, but there's sort of a, there's a specific presentation. That's why I said specific diagnosis, just because it gives you an idea of the presentation of the patient. That's why. I understand what you're saying.
No, your question is valid. 100% valid. I think majority of us have that question. Even though we hear it again and again, we seem to sort of forget. That's what happens to us. Something is there. Homeopathy is easy. The problem is we forget. And then we realize, Arey, this though I knew. Right? Okay, good.